Hello everyone, I am Dr. Donald Ozello of Championship Chiropractic in Las Vegas, Nevada. Welcome to today's episode of Dr. Ozello Sports Medicine Report. Today I'm going to cover the Pectoralis Major muscle strain. The Pectoralis Major is the large muscle in the chest. The Pectoralis Major has two heads, a clavicular head and a sternocostal head. The clavicular head is located superior to the sternocostal head. The pectoralis muscle strain can have an insidious onset or a sudden onset. The sudden onset usually occurs from a traumatic injury, while the insidious onset usually occurs in an overuse type of injury. This injury is very common in weightlifters and bodybuilders, especially in young weightlifters. It can also occur in track and field athletes who participate in javelin, shot put, and discus, and can also occur in the sport known as disc golf, which is also known as frisbee golf. Certain exercises contribute to a pectoralis muscle strain more than other exercises. These exercises include the bench press, especially when a wide grip is used, dumbbell flies, and push-ups. The pectoralis muscle strain has many contributing factors, including intrinsic factors and extrinsic factors. The intrinsic factors of a pectoralis muscle strain include hypertonicity or tightness or shortening of the anterior shoulder muscles, shoulder instability, and weak scapular retractor muscles. The scapular retractor muscles are the rhomboid major, rhomboid minor, middle trapezius, and lower trapezius. Weakness in these muscles contributes to scapular instability, which can lead to an increased amount of demand placed on the other muscles in the shoulder. Another contributing factor is upper cross syndrome. Upper cross syndrome is also known as upper crust syndrome. This is a postural fault where the muscles in the front part of the chest and the shoulder are pulling the shoulders forward. The neck is moved forward, the thoracic spine is flexed slightly forward, and the scapulas are protracted away from the spine. So these are the intrinsic contributing factors of a pectoralis muscle strain. The extrinsic contributing factors of a pectoralis muscle strain include poor technique and overtraining. Again, this is an overuse injury when there's an insidious onset. When there's an overuse injury, these injuries are caused by too much training, too large of an increase in volume of training, inadequate rest between training sessions and or competitions, and insufficient recovery techniques. Also, there can be just overall fatigue and poor nutrition and supplementation strategies. You want to make sure you use proper technique when performing any exercise. Poor technique can lead to injury. When you are performing bench press, you want to make sure that you use proper technique. You don't want to let the weight bounce off the chest, and you want to make sure that you are using an appropriate grip, because many times a wide grip is one of the main contributing factors for the pectoralis muscle strain. In overtraining, you want to make sure that you get adequate rest between your training sessions, and you want to set up your training routine so that you have built-in rest days and that you are not overtaxing any muscle group, especially the pectoralis major muscles. You can perform a manual length test on yourself to check to see if you have tightness or shortening of the pectoralis major muscle. And you can do this in two arm positions. You want to lay supine on the floor or on an exercise bench. Abduct the shoulders to 90 degrees. This is when the arms are straight out to the side, when they are perpendicular to the body. This is testing the clavicular head. And then you can also abduct the shoulders to 150 degrees to test the sternocostal head. You relax the shoulders and let the arms fall down towards the floor. The test is positive if the arms do not lower to the floor, or if you are on a bench, if they do not lower below the height of the bench. This would indicate hypertonicity or shortening of the pectoralis major muscle. If you have suffered a pectoralis muscle strain, or you think you have suffered a pectoralis muscle strain, or you start to feel pain in the chest, see a medical professional immediately. Do not hesitate. Again, see a medical professional immediately. You want to rule out any serious chest pathology, so that is the first thing. If a serious pathology has been ruled out, then you can see a medical professional like a doctor of chiropractic like myself, or you can see another type of medical professional. This will help you to get an evaluation, a diagnosis, and a treatment plan. Therefore, you will be set for your road to recovery. Always perform all rehabilitation and prevention exercises through a symptom-free range of motion. Even if that motion is very small, you want to perform all exercises through a symptom-free range of motion. Never perform an exercise that elicits or intensifies symptoms. If an exercise elicits or intensifies symptoms, please stop immediately and find a viable substitute. Injury prevention is easier, faster, and less expensive than injury rehabilitation. Therefore, you want to establish a solid training program where you have adequate rest between your training sessions. You want to train hard, but you want to train smart. You can work with a certified fitness trainer or a strength and conditioning specialist to establish a good training routine, which will give you sufficient rest between training sessions. If you do not have enough recovery between your training sessions, you will acquire an overuse injury. You may also acquire the traumatic injury, because many times the traumatic injury occurs because the muscle is fatigued from too much training and not enough recovery. So do yourself a huge favor and set up an intelligent training program that gives you sufficient rest between your training days. In your training program, you should strive to achieve proportional strength in the shoulder. One of the main factors of any type of shoulder injury is weakness in the posterior shoulder muscles. This includes the scapular retractor muscles, which I spoke about before. Again, they are the rhomboid minor, the rhomboid major, the middle trapezius, and the lower trapezius. Also, there can be weakness in the rotator cuff muscles and the posterior deltoid muscles compared to the muscles in the front of the shoulder. If the posterior shoulder muscles are weak, you want to make sure that you are training them properly and giving them enough attention so that you build these muscles, so that you build stability in the scapula, and that there is not a disproportion of strength between the anterior shoulder muscles and the posterior shoulder muscles. Therefore, you want to build balanced strength in the shoulders. So you want to put those exercises that strengthen the scapular retractors, the posterior rotator cuff muscles, and the rear head of the deltoid in your routine. Always perform a thorough warm-up before training, and always perform a comprehensive cool-down after your training. After your training is the ideal time to perform slow static stretches. You can stretch the pectoralis major, the pectoralis minor, the latissimus dorsi, the serratus anterior, and the teres major. This will help to reduce muscle tension. When you are stretching, move into the stretch slowly and hold a mild, comfortable stretch, then move out of the stretch slowly. If a specific stretch starts to elicit or intensify symptoms, stop immediately and modify the stretch or find a viable substitute. As a doctor of chiropractic, I have seen numerous patients with a pectoralis muscle strain. If someone comes into my office and I think they have a pectoralis muscle strain, I would do an evaluation of the cervical spine, which is the medical name for the neck. I would do an evaluation of the thoracic spine, which is the medical name for the mid-back. I would also perform an evaluation on the entire shoulder complex. There are 4 joints in the shoulder complex. I would perform an evaluation on the rib cage and on the upper extremities. I want to check the entire kinetic chain of the shoulder, and the treatment would be performed in the same areas. The objective is to remove the source of the symptoms. I would perform a chiropractic adjustment. The adjustment is going to help to reestablish proper skeletal motion and also to optimize nerve flow. If you have been diagnosed with a pectoralis muscle strain, you want to start your rehabilitation immediately. When you're performing any type of rehabilitation, always start at your current health, fitness, and strength levels. Do not start at what you used previously with any type of exercise resistance. Always start at your current health, fitness, and strength levels. You also want to always work through a symptom-free range of motion. Even if that range of motion is minuscule, never work into a motion that elicits or intensifies symptoms. And if any exercise elicits or intensifies symptoms, you want to stop immediately and find a viable substitute. You can perform slow static stretches through a symptom-free range of motion for the Pectoralis Major, the Pectoralis Minor, the serratus anterior, the latissimus dorsi, and the teres major. You also may be able to perform strengthening exercises for the scapular retractor muscles and the posterior rotator cuff muscles and the posterior head of the deltoid. You want to stretch the Pectoralis Major at a variety of angles. This can be performed while laying supine on the floor. You can also perform it while laying supine on a football or laying supine on a foam roller. Thank you everybody for watching today's episode of Dr. Ozello's Sports Medicine Report, where I covered the pectoralis muscle strain. I am Dr. Donald Ozello of Championship Chiropractic in Las Vegas, Nevada. I am the author of Running, Maximize Performance and Minimize Injuries. You can visit my website, championshipchiropractic.com, where you can get additional information on the book, and you can also find my blog. My blog contains articles on spine health, sports medicine, chiropractic care, nutrition, fitness, and health. Please feel free to like this video. If you have questions, feedback, or suggestions, please leave them in the comment section below. Please subscribe to my YouTube page, and always remember to train hard, but train smart. Get adequate rest between your training sessions. Utilize nutritional and supplementation strategies that work for you. Prevent injuries and rehabilitate injuries, and accomplish your goals.